Hello and welcome to the Eastern Psych course. I'm Seshni Mudlia and this tutorial is on the management for the sexual side effects station. So the instruction for the candidate is you're about to see Mrs. Blake. After seeing her husband, she wants to talk to you more about her husband wanting to stop the medication, which she also feels that he needs to stop. So the instructions to the candidate is take a history about the difficulties and address her views, concerns and expectations. So the mental checklist, candidates, which I want you to bear in mind and to write down as you approach the station, are the following 4 bullet points. So firstly, you want to acknowledge that this is a sensitive issue and that you have experience with dealing with this difficulty on a day-to-day basis. Secondly, you want to establish etiological factors for the sexual difficulties apart from it being possibly due to sexual side effects of the antidepressant medication. Thirdly, you want to establish what the impact has been of these difficulties on their current relationship. And fourthly, you want to then suggest a proposed management plan using a biopsychosocial approach again. Okay, so in this scenario that you will be facing from experience, you can imagine you will be seeing a concerned wife who wants her husband to stop the medication because it appears to be causing some sexual difficulties in their relationship. So the key skill here is to acknowledge that this is a sensitive issue and that it is also something which is important both to herself and to her husband, and that you share their concerns and that you're willing to listen to her and then suggest a proposed management plan. So the skill here is to try and gradually get the collateral history from her and at the same time then acknowledge your understanding of the situation and suggest to her that actually this is possibly due to the depressive illness rather than the sexual side effects as a result of the antidepressant. The only way in which you would be able to do this is if you do the station systematically and address her views, concerns and expectations as you go along. From my experience, the wife will be reluctant to speak to someone who is not sensitive and understanding her concerns and her expectations. So please, when you are approaching the station, be mindful that she has certain concerns and expectations of why she is speaking to you. And you would need to gently prize these out from her and at the same time impart some of the knowledge of why you think he is experiencing some problems at present. So the initial introduction, which I think would be a good approach, would be the following. Hello, Mrs. Blake. I'm Dr. Mudlia and I've just seen your husband. I understand that you wanted to talk to me more about his medication and that he wants to stop his medication. I would like to speak to you about this as I think it is important both to you and him. Can you tell me what your concerns are? So using an open question like that gives you a window of opportunity to actually find out what the difficulties are and then you can gradually use closed questions to ask more specific questions to get through your checklist. So this also shows that you are empathizing with her and you are showing her some sensitivity. And this is important, as we've discussed previously, that you are going to be discussing about their sexual history and the sexual difficulties, and therefore it's imperative that you do be mindful that you need to be sensitive at all times and have a good understanding of what she's actually going through. So once you've established and acknowledged that this is a sensitive issue, you can then move on to asking her more about the reasons why her husband wants to stop the medication. So then she would come out with that they are possibly having some difficulties in their sexual life. Before that, you might need to think about asking her more about the depressive symptoms. So you want to find out from her, and that's the second bullet point, is to find out more about his depressive symptoms. So you want to ask about how he was before he started the medication and how things have progressed since then. And this is key because you need to establish a rationale for your thinking that actually things have improved since he's been on the medication, and that the sexual difficulties that he's experiencing are not side effects of the medication, but actually part of the symptomatology of the depressive illness, which you would actually need to sell this to her later on. So the next step would be looking at the impact of the sexual difficulties on their current relationship. And this is where you're going to be asking some more personal and intimate details. So you want to ask her how have things been in their sexual relationship, whether there's been any difficulties in the past, whether they've had any previous episodes which needed any counseling, and also to establish what exactly are the difficulties. For example, you want to ask her whether there's a problem with husband getting an erection, or whether there's any difficulties in him ejaculating. These are symptoms which you might have already asked in the previous station, but it is important also to find out from her what are the actual difficulties. So once you've established the impact on the relationship and you've showed some sensitivity and understanding to this situation, to her and her husband, you then need to talk about possible treatment options. And like in the previous station, it would be a similar approach. So this would be a repetition of what you've discussed with her husband. So like I've said, you need to explain to her that the possible reasons for the sexual difficulties are actually symptoms of a depressive illness and not due to the SSRI medication fluoxetine. Although we as psychiatrists know that fluoxetine is known to cause sexual side effects, from the history that's been given by her husband and also by her, it is clear that although he did have decreased libido and desire before starting the medication, it seemed that actually these symptoms improved once he started taking the antidepressant, which then pinpoints us to the most likely cause of the current sexual difficulties, that it's due to the depressive symptomatology as opposed to sexual side effects of the medication. However, we will not rule out that this could possibly also be due to sexual side effects of the medication. which we know is something which is commonly found in someone taking SSRI medication. So the suggested proposed management plan, which you would need to gently discuss with her, would be the following options. Number one would be, you would need to explain that he could go on drug-free holidays. Two is that according to the guidelines which we follow, the NICE guidelines, the proposed duration of treatment is 3 to 6 months. The rationale is that once he is treated for the depression, for the proposed duration of treatment, that his symptoms of depression would improve, and ultimately the sexual difficulties would also improve. Thirdly, you could consider an alternative antidepressant which has a lesser propensity to cause sexual side effect. An example of this would be something like mirtazapine. Fourthly, you could suggest that there are other forms of treatment apart from medication. For example, the psychological aspects of therapy, which would include counseling, sex therapy, marital therapy, or any other forms of talking therapies which might be beneficial for them. And lastly, you would need to inform her that there is a danger that if he stops medication, that he could become unwell and revert to his depressive symptoms, and also that stopping the antidepressants can cause a discontinuation symptoms. She might want to ask you about something like Viagra, which I think has commonly come out in the exam, and your response could be that Viagra is something which is usually can be looked at as a last resort, and it's not something that we usually prescribe. And like all medications, that Viagra also has its own side effects. So once you've discussed all the possible treatment options, when you are discussing this, I want you to make sure that you're actually ensuring her that throughout the interview that you are listening to her and that you are on her side, because as you can imagine, this is something which is troubling both her and her husband, and it is something important to both of them. So at no point should she feel like you are not listening and you are not understanding the situation. I think this is where the difficulty lies in tackling the situation. One is that the person might not feel that you are understanding the situation, and two, because of the sensitive nature of discussing sexual difficulties and sexual relationships. So if you would approach the station in the way we've discussed it, I can assure you that you will find this an easy station to actually master successfully and have a clear pass in. So to recap, when you're approaching a station to do the management station for the sexual side effects, you would need to do the following 4 points. The first would be to acknowledge the sensitivity of the situation and the sexual difficulties. Two, to establish what the depressive history was and the etiology of the sexual side effects that he's experiencing. 3, you want to establish what the impact of these sexual difficulties has been on their relationship. And 4, you want to recap and suggest a proposed management plan. I've mentioned in the previous station that the wife might ask about the CPN. I think if she does, you need to respond by saying that you've spoken to her husband and he has come to talk about his sexual difficulties because he cares for her a lot. So provide her a lot of reassurance that this is important and that her husband has strong feelings for her. And this would be one way of tackling a difficult situation in which you might be placed in. So as I've mentioned, it is one of those stations which is tricky and which is difficult because you need to discuss some intimate and personal details. However, if you have a clear and structured approach, you would be able to master the station and actually might eventually see that it is not that a difficult station once you know how to manage the station. I hope you have found this tutorial helpful, and thank you once again for listening to this tutorial. Thank you.